Hi, this is Crystal presenting on a patient today. I have a 21-year-old white male patient. Chief complaint today is a sore throat. History of present illness. This patient came in. He's complaining of a sore throat that started up about 4 days ago. He denies any fever, shortness of breath. He just complains of a sore throat that makes it difficult for him to swallow. It's very painful. And he kind of alters his voice because he didn't want to swallow as much, so it's making him, he didn't want to use his swallow as much as he normally does. Review of systems: ears are clear, positive reflux, light reflex in each bilateral ears. Nose turbulence is clear. Throat is red, moderate to severely erythema present with white exudate patches present in the back of the throat. Denies any pain in the mastoid sinus area, denies any headache. Lymph nodes, anterior and posterior cervicals are palpable. Past medical history: patients had acute pharyngitis in the past, but it's been a couple years ago. No pertinent history. He's had bronchitis before, small other little episodes in the past 2 or 3 years, but nothing that's relevant to today. Social history: he denies any drinking or alcohol history. Allergies: he has no allergies to any medication. Current medication: he doesn't take any medication. Focus: the physical exam will basically focus on his throat and his symptoms. His lungs are clear. Heart sounds are fine. No shortness of breath, no wheezing, nothing's present in the lungs. Differential diagnosis will be strep throat with acute pharyngitis, also mononucleus, and post-tonsil post-tonsillary abscess. Okay. Treatment plan for each one: we went with acute pharyngitis. In this patient, we did a strep test. Strep test came back negative, but with his history of having acute pharyngitis that was related to strep in the past, she felt like it would be appropriate to treat him. Also, so we ordered him oral antibiotics, and we put him on cephalosporin, and we chose this instead of amoxicillin just in case, because we have the differential for mono, and the differential, we were concerned about it, so we went this route so he wouldn't get a red rash that is very common if you treat it with an amoxicillin and it's mono. The mono spot wouldn't show up positive because the symptoms has only been present for the past 4 days, and it takes 7 to 10 days, so we probably get a false negative. And as far as the post-tonsillary abscess, it could be possible, but the reason we didn't go with this one, you have to you go the same criteria, basically. You do the mono test, and you would do a CBC with differential and see if it was any leukocytosis present, which would be elevated, but that could also be elevated in strep or mono. Treatment plan for these as well would be oral antibiotics, plenty of fluids, and of course you're going to do voice rest and encourage analgesics such as ibuprofen, Tylenol, to aid in any pain or discomfort. You can also do warm saline gargles as well to help soothe with the immediate. We did encourage the patient to return if symptoms does not decrease, or if the symptoms get worse or do not show any signs of improving in the next 3 to 4 days. Thank you.